Global health issue, COVID-19.
Introduction. COVID-19, caused by SARS-CoV-2, exposed vulnerabilities in our globalized society. Rapid global spread led to a shared human experience, emphasizing mortality and fragility. The pandemic serves as a philosophical inspiration, prompting reflection on personal and societal freedom. Government policies on vaccination provoke discussions on justice and moral distribution.
Background of research. This research focuses on the extensive impact of the COVID-19 pandemic caused by the SARS-CoV-2 virus. Millions of global cases and casualties highlight the challenge of containing the virus, which undergoes mutations, complicating response efforts. Healthcare systems worldwide face strain, resulting in shortages and overworked professionals. Economic disruptions affect supply chains and employment, disproportionately impacting vulnerable groups.
Research objectives. To begin with, by analyzing the objectives of COVID-19 pandemic through philosophical perspectives, includes ethical inquiry, which aims to investigate the intellectual origins of the COVID-19 pandemic by exploring its ethical inquiry. Specifically, through the examination, the issues include distributive justice concerns about healthcare resource access, prioritizing marginalized populations, and ethical repercussions of public health initiatives on personal liberties. Furthermore, philosophical foundations of public health policies can help examine the ethical rationales for public health initiatives and behaviors during the pandemic, as well as their consequences for individual autonomy and societal systems. Last but not least, by evaluating the effects of non-pharmaceutical treatments, assesses the impact of pharmaceutical measures to lessen the need for healthcare and COVID-19 mortality, and also discuss the role of modeling and prediction that can help with public health decision-making.
Interview participants about COVID-19 based on their point of view. Research project employs diverse methods, questionnaires, surveys, focus groups, and one-on-one interviews. Extensive data collection focuses on global health challenges, with emphasis on COVID-19. Surveys feature both long and short answer formats to capture a range of viewpoints. Focus groups target individuals with direct experience of COVID-19. Diverse techniques enhance data validity, providing a comprehensive understanding of public viewpoints on COVID-19 and broader health issues.
less interaction with your friends and family.
有啊，就没有得出去哦，每天待在家坐着很久，要上网课这样。
你呢？
对我来讲是没有影响啊，因为我的生活也是在家上课，然后做工这样子吧。
那么学习上面的问题有吗？
的确是有一点影响的吧，就不能实体上课，如果有什么东西不懂的话，就不能问老师哦，就要靠自己读，就这样。在我方面的话。
对我来讲是更多是要靠自己，我们就要继续学习看，然后可能问老师方面就比较困难，因为没有的 face to face。more 就是自己上网去 search everything 啊，差不多是这样。
有啊，你们呢？
有
got none. Like your social lifestyle, do you think the pandemic got affected? Got lah. So how about your study difficulties? Do you face anything like that?
Yeah.
So how do you guys cope it?
I normally listen to music.
Listen to music.
Yeah.
How about you guys?
I didn't really study during that time.
How about you?
Yeah, I also don't really study at all.
Sorry. 那么如果好像你没有工作的话，那段时间你们经济也是有遇到困难，还是一样平常心样子？
对于我们来讲是，对我来讲是没有太大的影响，因为也是跟平常生活一样吧，对我来讲，只是出门还回来比较麻烦，因为可能要过 block 啊，or anything 这样子，比较麻烦一点，需要有一张证明还是什么才可以出门这样子。
Do you think this pandemic affect our psychology and emotion? Can you speak from your point of view?
Okay, I think it depends on the individual. If you are the tough type, if you are, how do you say? If you are spiritually strong, mentally strong, I think the impact is less. But not all of us are the same. Some of us, especially those sociable people, and all of a sudden you put them in a lockdown, they may have a bigger impact, right? Because during lockdown it's not easy. Imagine if you are a person who like to socialize, all of a sudden you are being locked down, and lockdown we're not talking about 1-2 weeks, we're talking about months. So yes, that impact that group of people. So it really depends.
Yeah. How about yourself? Like,
I'm okay because classes still go on for me, so I'm busy. It's just that I don't come to the campus, so I'm still working from home. Alright. Then in terms of interaction, no issue. Smartphone all working, so we just call up each other and chit chat.
的确都是有一点点吧，就我 mostly 我是一个喜欢出去玩的人，所以 during 那个 COVID 的时候，我就没有得出去，就会变到很缺乏，有那种空缺感，就少了一个东西，就是说，好像我不能出去玩啊，就不能跟朋友 hang out，就单单只是在电话，那个效果跟实体上是不一样的，就这样。你？
我是没有影响啊，没有影响，因为没有一样，就是跟平常一样。
Yeah, so currently COVID-19 measures like MCU and quarantine likely impacted people's mental health due to isolation. Are currently economic stress and disruptions causing heightened anxiety and stress. That's all for me.
Should ethical practical play a significant role in guiding global COVID-19 response, including fair vaccine distribution and ensuring access to healthcare for all?
Yes, ethical principles should be guide the global COVID-19 response, ensuring fair vaccine distribution and universal healthcare access for all.
Okay, thanks.
Thanks. Thank you. Okay.
And discussion. The COVID-19 pandemic has affected the entire world, and we're looking at it through the eyes of Western and Eastern philosophies. In the West, we explore ideas like doing what's best for the most people, utilitarianism, and finding a balance between individual rights and what society needs, social contract. Humanist focuses on how people dealt with the pandemic personally, and political philosophy looks at how vaccines are shared globally. In the East, Taoism talks about the need to be flexible and let things happen naturally, while Confucianism looks at moral leadership and keeping society in harmony. Both sides agree that everyone is connected, emphasizing the importance of working together globally during the pandemic.
Psychology and sociology. Sociology and psychology are essential to comprehending and resolving the complex issues surrounding the COVID-19 pandemic. It emphasizes how communities are interconnected and how important collaboration and solidarity are. Sociology and psychology highlight the importance of a comprehensive strategy that acknowledges the mutually beneficial relationship between social structures and people's mental health in navigating and overcoming the obstacles presented by the pandemic.
Philosophy of Sejahtera. From the perspective of philosophy of Sejahtera, COVID-19 pandemic pointing out the collective responsibility and the balance between individual right and the welfare of society. Combining different philosophical perspectives can result in a more comprehensive strategy for addressing global issues such as the ongoing difficulties caused by the COVID-19 pandemic.
Conclusion. COVID-19 led to high death rates and strained healthcare systems worldwide. It worsened social, economic, and health disparities, hitting vulnerable groups the hardest. The pandemic raised philosophical questions about life's vulnerability and balancing personal freedoms with community well-being.
Thank you.